A month back, a 35-year-old gentleman presented to me with a hunched back. He has noticed this problem some many years back in his late 20s, which has gradually progressed to a stage now where he is unable to see straight and he is unable to walk for long distances because he feels exhausted, tired because he has this hunched back. He had a thorough evaluation done earlier as well, where he was found to have a problem called Ankylosing Spondylitis. It is a genetic condition related to the rheumatology group of conditions where it affects the spine and the spine gradually gets bent and also has severe pain associated with it. Deformity was very bad when he presented to me, and on evaluation through X-rays and MRI, the deformity was such that it needed a surgery. Patient was very much concerned about his problem because he had been suffering with pain for a long time. Because of his hunched back, he was called out names, trouble with socialization because of this deformity, and he is more or less restricted just to his home just because he cannot go out of this. His family, which included his wife and a daughter, are also concerned because they were told that a surgery is a risky surgery and has risks of paralysis, which means that his legs can go completely numb and weak, and he can even lose his urine and stool control. So I had a detailed discussion with them, with the family, about the possible risks and how a center like an AIG, where we have advanced equipment and neuro monitoring facilities and with good trained surgeons, we can minimize the risks of such a surgery. So he was completely convinced with the conversation, and we took him up for a surgery the next day. The surgery went well, where we did an osteotomy, which is breaking of the bones at TL junction. We call it T12L1, where we do an osteotomy, which is we take off a part of the bone and correct it. It is a complex surgery if you consider spine surgeries, and the outcome was very successful. The patient was mobilized on the same evening of surgery. He was made to go to the washroom walking, and he was discharged in 2 days after the procedure. He came to my outpatient department 2 weeks later. He was very grateful for having had the surgery done. I think he is fortunate that he chose a place like AIG, where we have all the advanced equipment with well-trained surgeons. So I would like to stress out that procedures like this have to be done in good centers with well-trained surgeons, and it is also important that you notice this problem early. Few tips, such as in ankylosing spondylitis, patients usually have pains more in the mornings when they wake up, and the pain is associated with stiffness which lasts for at least 1 hour, 2 hours, and then they gradually get better through the day. If you are having similar symptoms, it could be something such as an ankylosing spondylitis, and if you have been suffering for more than 3 to 6 months because of such problems, it is necessary that you meet a spine specialist and take proper advice.